All right, so here we have Julie's foot. We're now just 5 days after having bunion surgery. Got some bruising over there, but we just stripped her toe. But look at that, just 5 days after surgery. She's not having any pain. And Julie had this foot done some 6 years ago before COVID hit. And unfortunately, she doesn't have a lot of range of motion with it. But she had a completely different procedure where they did this procedure up here in the arch and fused it. And I can feel a big plate in there with a plate here and a plate here with eight screws, she said possibly 9, and 2 plates, a plate on the side and a plate on top.
Yes.
So let's first off, Julie, why don't you compare and contrast about the amount of pain you had with each bunion procedure, and tell us about the intensity, length, and time that you had to endure pain with this foot as compared to this foot, which is only 5 days after surgery now.
So my first surgery on the left, I had the surgery with the plates, and that one I was in a cast and was in pain and on pain medication for like 5 days straight. And I have not had any pain with the procedure you did on the right foot.
Okay, no pain on the right foot at all. So right when the numbness
None at all. No Tylenol.
Nothing.
Nothing. I mean, I ice my foot. I follow your directions. So.
All right. So, tell us about the pain on the left foot then. I mean, what kind of pain medication were you on, and how long did you have to take it, and what was it like?
So I was on the oxycodone for 5 days, I think after surgery. Then I went on like a super strength Tylenol, 800 milligram, and Advil. I rotated. But I was in bed for 5 days, and I couldn't really go up and down the stairs or anything.
5 days. And this one, you've been able to walk immediately?
Yes.
Yeah. And you haven't had any pain yet?
No pain.
And you're not going to. It's already been 5 days. Yeah. You would have felt some by now, right?
I know. It's great.
All right. So what was it like getting around, let's say, trying to take a shower, getting up and down the stairs, driving your car? Did you need crutches, a scooter, or a wheelchair, or anything like that with your first procedure on your left foot?
Yeah, so I did have a cast, and then they redid the cast because I had to put that on again. I had crutches, I had a scooter to get up and down the stairs. I had to go scoot on my rear up and down. I was in bed for 5 days right after, and then with my right, I took a shower the second day. I did fine. No problems. Just wore the cast protector or the protector for the water.
Well, as you know, there's only 1 screw in this foot, but there happens to be 8 or 9 screws and 2 plates in this foot. And unfortunately, you can feel them, can't you?
Yes.
And so there's a big difference in terms of the amount of surgical dissection that you went through, in terms of the amount of internal fixation, screws and plates that were put in there. So, if you think about it, to take this screw out only requires 1 stitch and a Band-Aid. And on this one, not so much. You're going to have a lot of surgery, if you will, in order to get that out. So there's that difference for you. Well, as you know, we have x-rays, and we're going to show the x-rays of your left foot and how it looks now. We can see that there are a bunch of 1, 2, 3, 4, 5, 6, 7, 8 screws in there and 2 plates on the side. And so the procedure had, what was it called, the procedure that you had? Lapiplasty. Okay, so they're claiming that this procedure, if you just scrape off the bone like I did, it's going to be stuck out there, even if you shift it over, and there's still a big gap there. And so what they claim is that they're going to fuse this joint right here and keep it nice and narrow so it stays straight by putting those plates and screws in there. And of course, that's what it looks like from before and after on somebody else's foot. Yours looks somewhat similar, although I think it's slightly overcorrected. And right now you're having problems because the joint's jamming because the boat's elevated, but there's all the screws and plates that they put into your foot. Well, let's look at now your x-ray. Can I see her x-ray? Your x-ray. Now look at that. We have able to realign these 2 bones here they're back together side by side, and we just put one screw in there. We did not have to fuse this particular joint right back here, and it's painless.
No pain.
So it's no pain. And so you didn't have to endure all that extra surgery and pain and suffering
or drugs
to get a similar looking result. And after all, this is going to function much better than that. And it's painless. You're walking immediately. There you had a cast and crutches for how long?
Oh gosh. Well, it was 2 months, 2.5 months, and then I had a boot. Then I went back in and I did physical therapy also. So it was like 3 months, and then when I had the surgery done again because he accidentally cut the tendon in my big toe, I made him go back in and braid it up, fixed it up. So it was 6 months total of my life.
Wow.
And
well,
it was traumatic for me because I can't, I didn't even want to come back and do my other foot.
Right. And this one, well, in 6 weeks, you're going to be jogging on this foot. Okay, you're going to be out of the boot into a regular, comfortable tennis shoe in literally 4 weeks, and you're walking immediately now versus before, you're not walking on your foot for roughly 6 weeks. Or how long was it?
Yeah, about 6 weeks.
Yeah. All right. Well, I think we know the answer, but this foot here made you wait on this foot here, right? Because this one was such a miserable experience, you never wanted to go back and have any type of bunion surgery.
Right.
And how did you find out about painless bunion surgery?
Through a friend who was at my esthetician, Tracy. She referred me. She had both her feet done by you also. She had a great experience.
Okay. So obviously the first foot affected you mentally about making the decision to move forward on your right foot.
Oh, yeah. Definitely. Yeah. I was just upset about it. Needed to get it done. Knew I needed to get it done. Was in pain, but I didn't really want to take that time because I felt it would be, 3 months, 4 months. Who knows?
Right. Well, the nice thing is now, you're only 5 days after surgery. You can go work out right now as long as you don't transfer more than half of your body weight to your great toe joint. You'll be jogging in 6 weeks.
Yay.
And be up to speed in 8 weeks. And, yep. And drive immediately. Even though it's your right foot, you can drive today.
Wear a regular shoe.
Yeah.
Oh,
yeah.
wear a regular shoe. That's my whole thing.
Yeah,
But this foot, I can't wear a shoe right now.
Oh, because this plate sticks up so much on the top right there. There's a hump.
Yes, I
There's
can't
a hump
fit in
right
any
there,
shoe.
and it hurts, and I could feel the plates right in here.
Only one
Over
pair of tennis
and that
shoes
hurts.
I
I could
wear.
feel the length of it from here all the way to over
that's
there.
the problem.
Yeah. All right. Well, thanks for that, and we'll share this with everybody, and hopefully we'll shed some insight about bunion surgery and procedures to think about having and not having.
Thank you.
Okay, thank you.